All right. Well, welcome everyone and good morning. Happy Friday on this beautiful Friday morning. It's nice to see everyone's faces. My name is Katie Bruno. I am the Public Health and Wellness Program Manager at Health New England, and I would like to thank you all for joining us for Baystate Wings Hospital Annual Community Benefit Forum. Baystate Health and Health New England are pleased to co-host today. I would like to introduce you to my co-host for the next hour, Anna Marie Golden.
Good morning, everyone. Anna Marie Golden. I'm Director of Community Relations with Baystate Health. Great to see you all.
So we have a packed agenda in the next hour, so hold tight. And next slide, please, Anna Marie. So just a few housekeeping items. We would like everyone to participate and just to keep these in mind for the next hour. Please note this the forum is going to be recorded. So if you missed some of it or you want to watch it again, it will be available on demand at Baystate's YouTube channel. If you would like to ask questions, we're hoping everybody comes with lots of questions and ready to be engaged. Please either raise your hand and submit your questions into the chat. We will do our best to answer as many questions in the order. If you do not get your answer or question answered, we invite you to email the questions at governmentcommunity@baystatehealth.org. And we will share those submitted questions with responses with the slide deck and link to the recording later after the event has ended. Again, please mute your microphone. If you get called on, you can unmute it and ask your question. And I think that is all the housekeeping that we have. So I will turn it over to Anna Marie.
Great, thank you so much, Katie, for kicking us off. So we have two main goals today. Our first goal is to provide you with updates. We're going to hear from our Baystate Health leader, as well as Molly Gray with Baystate Wing. Katie and I are going to tag team and share Baystate Wing and Health New England community benefit updates, and we'll also hear from HNE leadership. And then our main course, the second half of our program, will be focused on the community health needs assessment. So we look forward to updating and hearing from our consultants regarding that project. So to kick us off, I do have a quick poll that I would like to share. And the question is, please describe your level of familiarity with the hospital insurer community benefits. So please check whichever one you feel relates. Great, thank you. Give it another quick second. All right, we're going to end that poll, and hopefully can you all see the results or no? You can't, okay. What about now? Yay, okay. Bear with me as I'm doing the technology too. So it looks like we have a majority of folks are somewhat familiar. We have a few that are extremely, and then we have a few that are not and slightly. So thank you all so much. I think it's important to know who's in the room as we continue to share our presentation with you today. So at this time, I am pleased to introduce our first speaker, Marian McGowan. Marian is a senior executive here at Baystate with more than 25 years in strategic, clinical, and operating leadership, specializing in payer and delivery integration and population health innovations. Marian was named to her current role of Executive Vice President and Chief Operating Officer for Baystate Health in July of 2020. She is responsible for leading the implementation of system-wide growth strategies and the performance of provider organizations and health insurance company, Health New England, where she served as President and Chief Executive Officer prior to her promotion in her current role. So Marian, thank you so much for being with us today, and we look forward to hearing from you.
Thank you, Anna Marie. It's great to be here, and I just want to shout out to all of you, community leaders, community members, who care about your community so much to be involved in this very important endeavor to identify needs and to have plans to try to address those. It's a Coming here, it was very impressive to see that you have such an integrated and thoughtful plan. And I look forward to your continued work in that regard. I just want to take a few minutes to talk about what I consider 3 pressing community needs. And one of those, of course, is associated with COVID-19. This graph that you see on this slide basically gives you sort of a diagram of how many patients were treated in the hospital, that's the blue line, over time, starting back as far as March 2 years ago to up till to date. And you can see that we've had waves starting at the very beginning in March and then all the way through this cycle of a 2-year period. I think what's most noteworthy here is how little respite time we had, if you will, between the 2 waves as the progression forward through the 2 years. It has been very impactful. Probably the biggest wave, the amplitude towards the right, is associated with Omicron. It was so contagious that the impact on the organization probably was the hardest, as well as it was the impact on the community. Overall, during this time period, we treated in the Baystate hospitals 8,648 people. Unfortunately, 879 members of our community passed away due to COVID in our hospitals. 529,645 had diagnostic tests associated with COVID. And most recently, 462 patients were treated in May, for example, and 462 people, total patients were treated, and 91 of those were in our hospitals as of May 31st. So you can see probably the most important thing about this is the next slide, which is the second point of concern for the community, is the high census that hospitals are operating in. A big portion of this is associated with COVID, of course, but there are other factors as well. Pent-up demand, impact of COVID on long-term symptoms influencing admissions, but also exacerbations of chronic conditions, most notably people associated with heart conditions, respiratory conditions, and even infection conditions not related to COVID. This particular graph demonstrates for you over that same time period of 2 years up to date, how many patients were in our hospitals collectively across Baystate Health, plus considering how many day stays, so what we call patient days. And it gives you a really good understanding of that amplitude of growth in terms of need for hospital beds. Now, the reason why this is important is possible that this is pent-up demand and it will settle down. We just don't know. And we do know that there are chronicities associated with COVID that will impact the community, and we need to be prepared for them. In addition to that, I think it's important to state that the hospital staff that care for these individuals, and even those who care for individuals in skilled nursing facilities, our home health organization, for example, are very difficult to find. Many of them at the beginning of this time period, felt like they needed to make a decision not to work in hospitals anymore. And so we saw a significant vacancy. And then that was further troubled by the number of people who were absent simply because they had COVID themselves. So it's been a trying time for hospitals in our community. It's an area to watch. Next slide, please. And a third that I want to talk about very quickly, and probably the most prominent, is associated with the demand for psychiatric care and the lack of resources, particularly acute care beds, to support the members of our community. So I want to break down this slide. If you look to the very left, you'll see a graphical demonstration of the Massachusetts and the various regions. You'll see region 1, which is our region here in Western Massachusetts, and more throughout the 5 regions of the state. Before I go any further, I want to mention what I mean by psychiatric boarding, which is what this map starts to talk about here, is that these are people in our organization who are presenting with psychiatric needs, who have to be in an organization with the care and programs that can support them. And they're waiting in general hospitals, emergency departments like ours to try to find a bed that will best support them and care for them. And so that's what we mean by when you hear this term psychiatric boarding, which is a big issue nationally and in our state as well, and as well, of course, locally here. So this particular diagram of the state then basically shows how many, this is just for one point in time, as of May 23rd, for example, 56 boarders in Region 1. You can see Region 2, 94, and on. So you get a sense that collectively, the number of people waiting across our state in our emergency departments, sometimes for weeks, to be able to get the appropriate bed, clinical service, and staff that can support them. And of course, the impact it has then on our general acute care hospitals. You can see one very important, if you look to the right, you can get a sense then for how this plays as it relates to even just weeks of the month. And I try to give you just the month of May to give you a feel. The total boarders in the orange line, and also the number of children who are boarding. We can go back to that slide, please. Thank you. So the impact is both on adults and children. The good news is that Baystate Health has worked diligently through this time period. And so because we had bed closures that happened in other organizations associated with psychiatric care, we were particularly vulnerable in terms of meeting the increased need that occurred during this pandemic. And so what we did was quickly, within a matter of 2 months, and with the support of the state Department of Mental Health, we were able to open up a 12-bed child and adolescent inpatient unit at Baystate Medical Center. In addition to that, we opened 6 beds associated with what we call observation or transition care. We have an outfit like that within our ED for adult patients, but we added additional 6 beds up on our floor to try to support that as well. And the good news is that we worked very diligently with partners in the community, like the May Institute, that's been able to assist us with addressing children with autism disorders, a significant percentage of the patients that have been increasingly waiting in our emergency department, our children's emergency department. And they've been assisting us in helping those children get the care they need, as well as to help to place those children in the appropriate environment to support their ongoing needs. I just wanted to share that with you because this is a pressing concern. I know you've identified it in your community needs assessments in the past, and it continues and probably has worsened through this time period of the pandemic. So that's really all I wanted to share with you today, except for I wanted to show you a quick glimpse at probably the biggest solution that we could put forth, but it is a little bit of a longer term solution, which is to build a completely dedicated psychiatric hospital, the Baystate Behavioral Health Hospital, in collaboration with a partner, which is LifePoint Kindred. This hospital, as you may have heard in the past, has been committed to the caring of individuals within our community, and it is targeted to have 150 acute care beds, which will treat both adults, geriatric patients, as well as children and adolescents. We expect to open this organization, which is located in Holyoke, and groundbreaking has already happened in March. And we expect to have it completed sometime late fall of 2023. This will be a state-of-the-art facility, and it will include beds specifically for people who need longer stays. We hope this makes an incredible impact, and we believe it will, to these issues, at least within Western Massachusetts. That's really all I wanted to share with you today. I hope that was helpful, and I'll turn it back to Anna Marie.
Thank you so much, Marian, for those updates. Really appreciate it. Yes, we have challenges, but we do have some exciting things in the works as well. So at this time, please join me in welcoming our next speaker, Molly Gray. Molly serves as President and Chief Administrative Officer for Baystate Wing Hospital and Baystate Mary Lane Outpatient Center, a role that she has held since 2019. However, Molly has a rich 34-year history of serving at Baystate Health in numerous leadership roles, including serving as Vice President of the Baystate Children's Hospital in Springfield, Women's Services, Behavioral Health Observation, and Emergency Services. Molly, thank you so much for being with us, and we'll turn it over to you.
Anna Marie, good morning, everybody. It really is such a pleasure to be here with all of you. Our Baystate Wing Hospital Community Benefits Advisory Committee is really such an important source of insight and frankly joy to me. Our team is facilitated by our excellent chairs, Gail Grammarosa and Michelle Holmgren. And I want to say thank you to that, because every month you bring such wonderful agenda items forward, and the team is an enthusiastic one. I will tell you that for certain. And all of the agencies represented by members of our team have really persevered so remarkably during this period of pandemic. As Marian just described, these have been challenges for every single agency, every member of our CBAC team, certainly, and they've really done an impressive job finding new, creative, innovative ways to continue to deliver service to people in our community. And it's just been very inspiring to have these folks as colleagues. We recently, our CBAC recently had the opportunity to host 2 business leaders from our area who just wanted to come and see what goes on in a CBAC meeting. And afterwards, I spoke with one who said, this was just amazing. It was like drinking from a fire hose, because all of the members talked about what their agencies are doing in our communities. And it was really very, very exciting. Just an inspiring team. So I just want to reflect back as we look forward here now to hearing about our newest community health needs assessment findings. I want to look back to 2019 and talk about actually 3 key areas that came out of that CHNA that we were able to use to inform the actions we needed to take in the Eastern region. And those, I'll tell you about 3. One was, the report really highlighted the high rates of chronic disease in our area, diseases that are sensitive to primary care. And the Baystate Health and Wellness Center in Palmer, here on the Baystate Wing campus, we were able to expand primary care and specialty care in one location. But in particular, we were able to recruit some really talented providers and clinicians and open a new service, which is convenient care. Baystate Convenient Care Palmer is its official long name. We are coming up on our 1st anniversary. The service is open 7 days a week. The team sees upwards of about 165 adult and pediatric patients, and sometimes as high as 190, 200 patients in a single day. The top 5 towns that are served are Palmer, Munson, and Ware, and they're pretty evenly divided. And then also some from Belchertown and Ludlow. And we see both Baystate medical practice patients and non-Baystate medical practice patients. And what really is the key differentiator from other kinds of urgent care or walk-in service is that we're able to, if appropriate, if necessary, link that patient and family to a primary care provider so that they have some another source of care going forward. Because many of our patients don't have an identified primary care provider of their own. So that was one key finding. Another key finding was just talking about the pockets of extreme poverty in our area with very limited access to transportation, what some refer to as a transportation desert. So just to remind you that since 2017, Baystate Wing Hospital has granted, actually the hospital and our medical staff have granted over $740,000 to the Quaboag connector. And that includes most recently funding the purchase and operations of a new healthcare van that's also known as the Health Connector that we expect to see on the road soon to provide free single-family transportation to and from Baystate Wing Hospital services, including that convenient care that I described. The other, another big one that I want to talk about and just sort of reflect on what's happened, certainly substance use disorder was highlighted as a key area of need in our community, just really having a devastating impact on our local communities. Baystate Health launched the Words Matter campaign. That was really meant to address discrimination and judgment in healthcare settings and improving our own caregivers' knowledge about substance use disorder. So there are a number of of initiatives that were undertaken under that umbrella of the Words Matter campaign. Our ED care here locally evolved and became definitely more robust with medication treatment, if necessary during the ED visit, and Narcan kits available, and really a lot of work overcoming sort of people's bias around how best to treat folks with substance use disorder. And we definitely have been collaborating with our local community agencies, including the Quaboag Hills Substance Use Alliance and the Ware Regional Recovery Center. So you'll be hearing some more about some additional grants coming forward. But it's been really, really important work for our community and so well informed by our community health needs assessment. So that's why we're looking forward to launching our next cycle here with all of you. Thank you.
Thank you so much, Molly, for those updates, and thank you for your leadership at Baystate Wing. So at this time, I would like to share my screen again. Hopefully you're just seeing, great, okay. So I'm gonna give a quick update on community benefits at Baystate Wing. I'm gonna go through some of these slides a little quicker because Molly did touch on a few things. So yes, just a big shout out again to all of our Community Benefit Advisory Council members, Michelle Holmgren and Gail Grammarosa, our amazing co-chairs, and every single other individual within the hospital and in the community that serves. Thank you, we appreciate you. And this group does meet monthly virtually. And if you would like to learn more, feel free to contact Michelle Holmgren. So at this time, I am going to share with you the community benefit expenditures. So we are required to report annually to the Attorney General within the state of Massachusetts, as well as the Internal Revenue Service on our community benefit expenditures for all of our hospitals. So what goes into these numbers? It's not apples to apples, unfortunately. There are some key differences. So we are not able to count health profession education. We are, an academic system. We're not able to count research or Medicaid losses on the on the Attorney General reportings. So you'll see in the red where there are some, areas and the differences that go into those numbers. So, and the reason why I'm sharing this with you is when you look at these numbers, you can see there's quite a big variance when we look at the Internal Revenue Service numbers, which are on the top, compared to the Attorney General. So for example, FY21, which is our most recent reporting, on the IRS side, community benefits for Baystate Wing was over 12 million, and that's significant. But on the AG, per their guidelines, it is 1.1 million. So there's a big difference there. And I always try to ask folks not to look into the numbers too deeply. There is so much that beyond the numbers in terms of the great work that's going on. And there's work that we can't always count as community benefit as well, that is amazing work and also contributes to addressing needs in our community. So one of the ways that we demonstrate this is through grant making. So we were fortunate to have a recent grant proposal this past spring, and Baystate Wing was allocated $200,000 to invest, and we had a local grant review team, and they selected the Quaboag Valley CDC and the town of Ware as a partnership to work with youth in education and a pathway to employment. So just want to extend again our congratulations to the town of Ware and the Quaboag Valley CDC for your award with this grant. And congratulations to all the other grantees throughout the Baystate Health System. It was a very competitive process, and just some amazing initiatives were funded. Molly touched on this a little bit, but there are some recent grantees that will be shared shortly more publicly, but we're pleased to recognize the Quaboag Valley CDC, the Quaboag Connector, the Ware Fire Department, and the consortium, specifically the Ware Regional Recovery Center, are all recipients of Baystate Wing corporate grants that were just approved last week. So congratulations to each of you for those awards. And in addition, I continue to be blown away by the Baystate Wing employees, given all of the challenges that Marion shared and that Molly shared. just how they continue to be so generous in giving and caring about the community. So a few examples of these are we have continued our support and participation in the Ware mobile food distribution. Employees each year have been extremely generous in back to school supply drives that are then donated to the local elementary schools in the Baystate Wing service area, as well as a holiday drive to benefit Behavioral Health Network in families experiencing domestic violence. So just continue to be blown away every year by their generosity and participation. And then we have also continued our partnership with the Scantic Valley YMCA to bring our Baystate Mighty, which is our pediatric weight management program, to youth in the Baystate Wing service area. I also want to give a shout out to our PERCH program, which is our medical students. And I want to recognize Dr. Sarah Perez McAdoo and Kelly Lamas that are in the room here with today. I think our PERCH students have a very special place in their heart for the Baystate Wing Hospital community. They have done some of their population health clerkships in the community, and many of you have probably seen the Baystate Health WOW bus, Wellness on Wheels bus in the community as well. So thank you for your support and engagement with our medical students in the Baystate Wing community. And with that, I'm going to turn it over to Katie to introduce our next speaker.
Thanks, Anna Marie. I would like to give a warm welcome to Sue O'Connor, who is Vice President and General Counsel at Health New England. Sue joined Health New England in 2008 and served in various roles. Her current responsibilities include leading all aspects of corporate and strategic legal initiatives while overseeing both in-house and outside counsel. She is our fierce leader, Health New England's diversity, equity, inclusion, and belonging activities and strategy. And I'm happy that I get to work with her as she oversees our community benefits program at Health New England. So Sue, the floor is yours.
Thank you so much, Katie. And you are the driving engine behind everything we do in this realm. So thanks so much for your efforts, and good to see everyone here. It really is a pleasure to be here virtually with all of you this morning. I just want briefly about Health New England. 35 years ago, a group of local physicians and hospitals formed Health New England, realizing that when you take health care and health coverage and put them on the same team, there's a really special opportunity to care for a population and community. And to this day, Health New England and Baystate Health share the same mission to improve the health and lives of the people in our communities. And Health New England, some of you may not know, as a not-for-profit health plan, is owned by Baystate Health. We provide coverage for over 185,000 members in the commercial Medicaid and Medicare markets. We're based right here in Springfield. We proudly provide coverage in the 4 counties of Western Massachusetts and Worcester County. Next slide, please. So our Medicaid ACO, called the BeHealthy Partnership, is really the example of when healthcare and health coverage come together. You can do great things in the community. The BeHealthy Partnership and the Baystate Healthcare Alliance, which is comprised of the 4 Baystate Health Centers and Caring Health Center, which is a federally qualified health center, comprise the partnership. And since 2018, we've provided healthcare and innovative clinical programs to over 45,000 MassHealth enrollees. And I just want to take a moment to give you an example of how the partnership works in the community to focus on social drivers of health and health equity. And that example is just one tiny example of all the innovative programming in the partnership, but it's called Nutrition RX. It's a program that's, we work with Revitalize CDC, and it provides services aimed to improve health outcomes for patients with uncontrolled diabetes. Each patient in the program receives a cooking appliance of their choice: a microwave, a slow cooker, an induction cooktop, a kitchen supply bag, diet education, and then 10 weeks of home-delivered nutritious groceries, which are specially curated by dietitians and then delivered to the patient's doorstep. The groceries, importantly, are culturally tailored, and they feature foods that promote a carbohydrate-controlled therapeutic diet. Next slide, please. And this is just an insight into the expectations of MassHealth and ultimately CMS for the next 5 years. You may not know they were in the middle of preparing an RFP do this summer for the next 5 years to care for this population together along with Baystate. And the next 5 years, you can see, will focus on, importantly, health equity, health-related social needs, primary care, and behavioral health integration. So you can see the themes here from all the way from Marion to Molly to Anna Marie in terms of these critical themes in our community that hopefully we all get to work together on. And then finally, the next slide. Thanks, our call to action. Like many organizations, CHNA deepened its commitment to diversity, equity, inclusion, and belonging immediately following the murder of George Floyd. A group of CHNA associates at the time, which included Katie leading the charge, really was kind of figuring out what we should do to respond to these public health crises of structural racism and inequality. And at the same time, Marion McGowan, CHNA's CEO at the time, drafted a public statement and the a 5-pillar call to action, which you see here, which really created the foundation for a DEIB committee and our multi-pronged approach to embedding DEI into our mission, our operations, and the values. And this year, excitingly, in support of Pillar 4, which is advancing health outcomes, we launched our Health Equity Committee. And the goal of that committee is to ensure that Health New England considers equity in all our organizational decisions and to bring a health equity framework to all our corporate initiatives. That's a brief, I'm happy anyone, please feel free to find me if you have any questions about these. I'm going to turn this over now to Katie Bruno, our Public Health Wellness Manager, to tell you about our Community Benefits Program. And as I said before, she really is, this is where her heart and passion is, and it shows up every single day in her work. Thanks very much.
Thank you, Sue. That was great, and a big smile for all the nice words, so thank you. So Health New England, I know we're short at time, so I'll make this as quick as possible. Last year, Health New England invested $700,000 of community benefits back into the community and partnered with over 100 different local non-for-profits. One of our main grant programs is our Where Health Matters program. This launched back in 2018, and since then we have committed over $1.2 million and partnered with numerous organizations. So over the last 2 years, one of the things that I'm most proud of is we were able to award multi-year commitments. And in doing so, this encouraged to build capacity and that true sustainability within the community and to hopefully really move that needle. Awarding 2-year grants and 3-year grants, so to really be able to make a difference in the community. These grants focus on social determinants of health, health equity, again, investing in our communities, providing education, technical assistance, incorporating population health perspective. These programs drive health improvements using evidence-based methodologies, encouraging collaboration with community partners, as well as strengthening Health New England's commitment with the community. So these are our previous grantees. And then, nope, you're good, sorry, Anna Marie. And then the last 2 years, due to COVID-19, we were able to quickly start these COVID-19 mini grants. So the COVID-19 mini grants were able to give back to community that were obviously struggling. So focus on childcare, food insecurity, housing, mental health, physical education, the digital divide. So really the COVID-19 mini grants were able to help organizations in the community due to COVID-19. So last year in 2021, Health New England awarded $200,000 to COVID-19 and was able to partner with 67 local non-for-profit organizations. So again, Health New England oversees 5 counties, and we were able to partner with organizations in all 5 counties. And lastly, the start of our DEIB committee, we also started up our DEIB mini grants. So these grants were a little bit more targeted. Last year, for example, Health New England awarded $64,000 in DEIB grants to 15 organizations. So 2 of those grants went to paid internships for emerging youth leaders. about $20,000 went to supporting programs that focus on gender identity and sexual orientation. And then almost 40,000 went to programs that focus on food insecurity. So we're really able and proud to bring these grants to the community and to really partner and make a difference for those who live, work, and play in our communities. So again, if you have any questions, I have my clock here. Please feel free to raise your hand or put questions in the chat. We'll give 2 minutes for questions, and if nobody has any questions, or if you think you have one and forget, you can put it in the chat later on, and we'll get back to those after the call. It's a quiet group this morning. Everybody needs their coffee.
Thank you so much. I am trying to, I see a question in the chat, and while you do that, I'm trying to launch our next poll.
All right, here's a question. How are you engaging schools in the health equity work? And is that for Baystate or Health New England? Both. All right. So for, I don't know, Anna Marie, if you want to go over with the school part for Baystate Health with the medical school, the students.
Yeah, so one of the things I mentioned was our Perch medical students. They their whole curriculum is aligned with our community health needs assessment, which has a health equity framework, and they are working in the community with various community partners to do projects and to address needs and through a health equity framework. I would say we also have a few other initiatives that we're doing. Our Baystate Springfield Educational Partnership, which I'll put a link in the chat for, as well as a place-based investment that we did in the Baystate Academy Charter School, which is for students grades 6 through 12 in the local Springfield area that have an interest in health careers. So really building that pipeline. Oh, that's great. So thank you so much. Those are a few additional examples of how we are partnering with schools. Great. All right, I'm having some technical difficulties with our polling. Oh wait, nope, here we go. Okay, so our next question is specific to the CHNA, and maybe Katie, if you want to introduce our speakers while folks are responding to this.
So I would like to introduce Kathleen Zegda, who works for the Public Health Institute of Western Mass, and Kate Lipton, who works for the Collaborative of Educational Services. So they are going to share with you all our CHNA program.
Great, and we're almost ready for our poll. I'm going to end it. Hopefully you can all see. Can you see the poll results? Yes, okay, great. So please describe your level of familiarity with the community health needs assessment. Looks like we have at least everyone is somewhat familiar, and a few folks are more familiar. So thank you so much for participating in that. So I'll turn it over to Kathleen and Kate.
Great. Are people able to see the slides? Okay, although the poll is showing up. Hold on one second, blocking the slides for me. So thank you so much. Happy to be here today. I'm Kathleen Zegda. I'm with the Public Health Institute of Western Massachusetts, and I'm going to be speaking along with my colleague here from the Collaborative for Educational Services, Kate Litton, about the community health needs assessments that are in process right now. Very exciting. And here on behalf of a consultant team that also includes the Pioneer Valley Planning Commission and the Franklin Regional Council of Governments. Okay, so the community health needs assessments that we are conducting. So this is the third cycle that our consultant team has been working with the Coalition of Western Mass Hospitals and Insure to complete. And the coalition is a partnership, and it includes hospitals, 8 non-for-profit hospitals and Insure. And very exciting this year is that Berkshire Health System is going to be joining. So that is great. And it was initiated in 2012 as a way to for the hospitals to come together and Insure to share resources to do the CHNA, but also thinking about needs in the region as well, and has involved some collective action in the past around mental health. And it was a unique model in the state, and even thinking across the country. It was exciting that a group of hospitals and Insure would come together to do this. And there's a strong focus on collaboration and community engagement. I know we're a little short on time, so I'm going to move through some of these quickly. It sounds like most people are familiar with the CHNA, at least those who completed the poll. So very briefly, CHNA, or Community Health Needs Assessment, is focused on identifying the top health needs. It needs to be completed by nonprofit hospitals and Insure every 3 years. Different requirements for hospitals for IRS, and then also there's Attorney General requirements as well that both the Insure and hospitals have. And it's an opportunity for hospitals to partner with communities to really inform their planning, but also help to support identification and alignment amongst community partners to focus on needs in the area. So we spoke a little bit about health equity. So when we think about health equity, I would love for people to put in the chat if they're familiar with health equity, and then if so, what it means to them. And so this is a graphic that we've used in this round of the CHNA, and some people may be familiar with the tree graphic. And you can see at the top are the health outcomes, and then really thinking about those drivers. We heard talk about determinants of health or drivers of health. So there's behavior, which are the branches. And then when you really get to look at the trunk and the drivers, social determinants of health, things like employment and housing and education and the neighborhoods we live in the built environment. And then looking at the root causes, there's various systems and structures and dominant culture and narratives, things related to racism or ageism or other types of inequities and drivers as well. So there's been a strong focus over time on really partnering and hearing from community as part of this process. You'll see at the bottom is the spectrum of engagement, and the coalition has been committed, and us working with them to continue to move this process towards the right, which is more engagement, partnership with the community. And so this round with the Regional Advisory Committee, who works with the consultant group in the coalition to help design what the CHNA will look like, think about dissemination. There was the coalition committed to stipending community residents, so that was really wonderful. And then in addition, there's a steering committee, and the coalition, which is made up of coalition members, the Coalition of Western Mass Hospitals and Insure, and community representatives were stipended to be a part of that. So a commitment to having community voice in that process for this. And you'll see a number of people were part of this whole process. And this is so far, again, it's ongoing, but through focus group and key informant interviews and community chats. And then also there was a survey. A number of people have their voices in this process. So when we think about this process and how we've changed it this round, similar to before, it's really building off the previous reports, community health needs assessment reports, and the prioritized needs that have been identified. Many of the needs continue to be needs. Molly spoke to some that the hospital is working on at Baystate Wing, and they continue to be needs. And what we really tried to identify is what has changed and what other needs may have arisen, particularly given COVID-19 and the exacerbation of inequities. And so we updated the report, and this time around, with the prioritized community health needs, there was a focus on making them more actionable. So it will look a little different to people because there's a regional prioritized need, and then which was youth mental health, and then there's 3 hospital specific needs that we dove deeper into and then touched very briefly on the others. And the hope is there's more information to make those more actionable. And then you can see from this, we have the reports, and then those reports are used for a number of different things, both hospital and community level. So this is the wing service area. And you can see when we do these reports, really focusing on communities, the counties, feedback we consistently heard don't necessarily reflect the service area. So we have some communities here in Hampshire, Worcester, and Franklin. I mean, not Franklin, Hamden. So these are the preliminary prioritized health needs. We're still in process of doing the report, but this is what we're anticipating. And so it's grouped by social and economic factors or determinants that influence health, barriers to healthcare access, and then health behaviors and outcomes. And so building off of the previous identified or prioritized health needs, similarly, we see these social and economic factors, access to basic needs, that was a hospital focus area, educational attainment, financial health and well-being, another hospital focus area, employment and income, violence and trauma, another hospital focus area, and the climate crisis. And then barriers to health care access, availability of providers. Marian touched a little bit just thinking about the strain on the providers in the system and other barriers related to access, which COVID-19 has really lifted up as well. And then health behaviors and outcomes, youth mental health, the regional focus area, mental health and substance use, again, touched upon, chronic conditions as well touched upon, and infant and perinatal health and Alzheimer's disease. It was so great to hear some of the actions that have taken place as a result of the CHNA previously. We do this work and it's great to see what's taken place. So in our report, and we touch upon COVID-19 impacts, and many people are probably familiar with many of these already. Some of the things, severe illness and loss of life, as was described earlier, unemployment and other economic impacts. We know it's had a huge impact across our nation and then in our region as well. Housing instability, impacts on food insecurity, the delay in accessing healthcare, and then of course the mental health crisis, which we'll speak to as well. So as we speak a little bit about the regional priority, which is youth mental health, just to give some framing from a regional perspective. So this was during COVID, and the Mass Department of Public Health did a community COVID impact survey, and the Public Health Institute, where I'm from, of Western Mass, is doing analysis for Western Mass as a technical assistance provider. So what we heard from respondents in that survey, among youth, 45% of youth felt so sad or helpless every day for 2 weeks or more during the past 12 months. And this is consistent with what we see in the localized reports too that we hear from youth. And then when you look at really the experience impact from COVID itself, an extreme impact on mental health, 19% of youth experienced 3 or more PTSD-like reactions to the COVID pandemic. So really impacting our young people. And then when we start to dig a little deeper and look at who's impacted more, some of the groups that we see that experience inequities similarly. So youth with disability, more or greater 2 times, LGBTQ plus youth, and also when we're thinking about mental health, female, and also those living in rural areas. I'm going to turn it over to Kate now, who's going to speak about more about youth in the wing service area and then the qualitative data that we heard.
Thanks, Kathleen. Hi, everybody. I'm Kate Litton at the Collaborative for Educational Services. And I'm going to go pretty quickly. The slides in some ways will hopefully stand for themselves, and then there's more detailed reports that you'll all have access to. So this is a little bit more data on youth perspectives in the Quaboag Hills area. It comes from the Prevention Needs Assessment Survey from 2021. Full survey results are available, and I will turn to my colleague Gail if she wants to post in the chat how to access the full results. And these data points that I think most of you can read are about how things have gotten worse during the pandemic. And they were already incredibly high rates pre-pandemic. So young people are feeling even more often anxious, lonely, isolated, as we know. but the rates were really, as Anna Marie says, heartbreaking. And I come to this, I have to say, as a researcher and also as a parent of 2 young adults. So I feel this very personally, and I know many of you do, whether in your clinical work, in your community work, in your family work. This is something that's touching so many of us. I'm going to, Kathleen, if you can go to the next slide. So at the Collaborative for Educational Services, working with Public Health Institute and the Franklin Regional Council of Governments, we led a qualitative study about youth mental health. What does it mean to different people? It's not like a really simple clinical understanding. And we'll go into that a little bit. What are the strengths and gaps in each service area that community benefits advisory groups, that hospitals, that community organizations can work from and build upon? The methods we used were primarily interviews, in-depth interviews, tending to last at least an hour with mental health professionals, community organizers, youth professionals, people doing youth leadership work, working with youth groups, to get as close to the young people as possible in terms of how are young people experiencing life, how do they define well-being, how do they define mental health, and we are also identifying groups of young people that are interested in engaging in this conversation and helping to design more appropriate supports. Next slide. I bring this quote to you, and I'll just read the first part. You all can read the rest of it, that we're coming into the space from different experiences with different expectations. This is actually from Cheryl Dukes, who led the research team, the research subcommittee for the CHNA. And I invite you all to enter in the chat. What does youth mental health mean to you? What words come to mind? Just drop some words in there. And I'm going to go over some of the words we heard, but I'd love to hear from this group what you all think about when you're thinking about youth mental health. So if you all can drop some words in the chat. And again, this quote is just, we come with really different assumptions, access points, perspectives, and experiences that so affect how we experience mental health, well-being, community supports, clinical supports. And next slide. So these are some of the words we heard when we talked to the various folks we talked to. This is not exhaustive, but I think it provides an example of the wide range of ways people are defining mental health or thinking about mental health. So there's some of the standard words you might think about, like diagnoses, anxiety, depression, suicidality. And many people also talked about oppressive systems, racism, violence, the trauma that young people are feeling just by living in the everyday world. And gives you a sense of the range. And I see many of you are naming some of the same things in the chat. Next slide, Kathleen, please. Again, these quotes give you a little sense of how people are talking about mental health. And you all identified some of the horrendous stats about waiting lists, lack of bed space, and knowing that the first quote, the kids that are housed in ER waiting for an inpatient bed, driving sudden interest. It's a resource problem related to inpatient beds, and it's just the tip of the iceberg. And that is certainly what we saw, that kind of acute clinical cases are a tiny piece of the huge epidemic we're seeing. More broadly, this one person said this, explained it in a way that I think is really accessible, that economic disenfranchisement produces people who can't sustain themselves economically, educationally, financially. The impact of that on the family in terms of depression, mental health, physical health, and education. We've got generational patterns. All of these have a profound impact on the mental health of the young people around us. And there's no simple solutions. We need community supports, we need economic supports, and we need mental health supports. This slide probably doesn't speak to itself, but in some ways it identifies the tensions that we saw in all the findings. Again, no simple answers. So if I look at the line about quality services, yes, we absolutely need more clinicians, more beds, more therapists, more providers. And you need sustained relationships. Some of the young people and the people who work with the young people talk about, it's really hard to find a therapist that they feel comfortable with. They find a therapist they're comfortable with, and then that person moves on, right? We have these fairly short tenures for a lot of new clinicians. And the absolute need not just for more clinicians, but culturally informed, culturally competent clinicians who people can relate to, young people can relate to and feel comfortable with and feel respected. A lot of our medical model, there's a fairly fast in and out, and it takes time to build a relationship. So, and relationships are the key to so much of this. Another one of the tensions we saw is schools. So many people highlighted schools as a great place. You've got all the young people there. You've got them there all day. Let's integrate more supports in the schools. Other people see the schools as places where kids do not feel comfortable, do not feel safe, and where their focus is on academics and state mandated learning goals. And it's really hard for them to squeeze anything else in. But there are certainly opportunities there. Similarly, service design is another one of the tensions. I see you all as a group of people in community collaborating, and that is so much what the young people need, is that collaboration from different perspectives. And youth-centered planning and youth-engaged planning, so that the services, the supports that we build kind of make sense and are appropriate for the young people we're trying to serve. Next slide, please. These are some of the assets that folks in the Quaboag Hills region identified to build upon. A lot of focus on youth-centered programming, peer support groups, and adult and peer mentoring programs, building on the community centers, community programs. And again, in the community benefits grant programs, I see you working so closely with the community providers. Place-based clinician training, we certainly heard about the PERCH program, and thinking about how to do place-based that builds on, that works with people who are already in community. Also heard about, people are excited about the new expanded acute care facilities. And a lot of people talked about more training for our pediatric providers in primary care, so that that is also a place that most of our young people are being seen. How can they be more supportive in terms of mental health? Knowing that we are short on time, I think I'm going to leave it there.
Thank you, Kate. And then I'll just touch briefly on the other two focus areas. Again, we're continuing to solidify all of this, but just some examples. So one was access to basic needs, and just thinking about how COVID has really impacted this, and just inflation, and thinking about housing and home ownership, important to think about. And we know in terms of housing prices, and this focuses on Hampden County because we have county specific data for this, but just to give an example, the prices rose almost 14% in 2021. So when we think about what is affordable for people, that's really challenging. And then also looking again, this was in 2020 from the COVID Community Impact Survey, almost 40% of respondents in the wing service area were worried specifically about paying their housing related and or utility expenses. And then when we look at rural, because we also did analysis looking at rural, 33% of respondents reported that. So housing was definitely of a concern. And similarly, food security, again, as there were impacts on employment and really the resources people had available to them in general. We saw a rise in food insecurity over the course of the pandemic, which has decreased, but we know this is an important area still to focus on. And then the other focus area for the Baystate Wing Hospital is financial health and well-being. And we're still, again, looking and pulling together some of that information, but already spoken to the impacts from the pandemic, and then also impacts on inflation, and even looking now. And so this is just an example looking at unemployment rates. And so these are by county, and you could see a sharp rise of unemployment over the course of the pandemic and a decrease, but still more work to be done. So I will turn it back over to Anna Marie and Katie. Sorry to go through so quickly for that. And if you have any questions, please just put them in the chat, or you can reach out as well.
Great. Thank you so much, Kathleen. I'm going to wrap us up, and simultaneously, Katie has a couple other polls that she's going to launch while we close out. So we hope that you found today's program informative and helpful and interesting. We hope that you will continue to stay connected with us. And so a few ways that you can do that. We're always recruiting for folks to serve on our patient family advisory councils. Each of our 4 hospitals have one. Our department at Baystate Health Government Community Relations, we have a monthly newsletter that we send out that shares a lot of the work that we're doing in the community and upcoming events as well. We have ongoing funding opportunities through Baystate and Health New England. You can check out our community benefit reports on our websites. View previous CHNAs, and our new CHNAs will be finalized and published this fall. Like and follow us on social media. And we are going to be doing a public launch type of event this fall, hopefully in each of our hospital service areas related to the CHNA. So we hope to see you all there as well. And then we will have our Community Benefits Forum in 2023 next June, and we'll hopefully be planning some exciting updates and other new topics to share with you at that time. So I've provided some other contact information here. So please, if you have any questions about anything that was shared, if you have any questions that weren't answered or any questions that come after the fact, please feel free to email us and we will do our best to respond and get back to each of you. So Katie, do you want to launch the polls?
Yep, I have been launching the polls, Anna Marie. So we're, yep.
Sorry, I can't see.
No, that's okay. That's okay. So I know we're at time. So there was a lot of interest in a potential in-person for the first question. And then now we're just doing the CHNA launch topic areas. So yeah, great participation.
Well, with that, I want to thank our speakers. I'd like to thank Marion, Molly, Sue, Katie, Kathleen, Kate for your contributions today. And thank you to each of you for being with us and sharing your morning. Happy Friday, and I wish everyone a wonderful weekend and happy summer.